My name's Dr. Elizabeth Henderson. A big part of my practice is breast cancer. It's about 20% of my practice. I think cancer is terrifying. It doesn't matter who you are, nobody wants that diagnosis. And one of the great things about being a surgeon is you can surgically remove that cancer and get the patients closer to a point of cure. Some signs and symptoms that you should not ignore when it comes to your breasts are if you have any nipple discharge or bleeding, if you can see or feel a mass, if you have breast pain, if the breast looks different, things like it's just riding a little higher or it seems shrunk in, if the nipple has changed, if the nipple is pulled in. So it's really important for women to at least once a month do a self-exam, make sure nothing has changed, and go see a doctor early. If you're worried at all, just come see a physician and we'll help you with next steps. One of the major things that we consider when we're treating breast cancer is how the patient is going to feel about their body afterwards. So of course, when we're treating cancer, the main priority is always cure. It's cure, 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 cure. But also at the end of the day, we do want you to feel comfortable in your own skin after going through this terrible disease process. So oncoplastic breast surgery is kind of the incorporation of treating the cancer, but also making sure that the breast looks good after surgery. Especially with breast cancer, there is a common misconception that it is genetic. So women think, oh, well, nobody else in my family has breast cancer, I can't get breast cancer. Unfortunately, it's the opposite. So most cancer is not genetic, in particular breast and colon cancer. And we want women to realize that they need to start screening for breast cancer early. So in the absence of any family history, the recommendation is to get a yearly mammogram starting at the age of 40. We want to be able to capture these cancers when they're little, when they're stage 1. When we're able to capture them early, the chance of a good outcome is higher. Once a year, every year, starting at the age of 40, you do need a screening mammogram to ensure that you are not developing any sort of breast tumor. Obviously, nobody wants surgery, no one wants to be dealing with cancer, but seeing how happy they are that that cancer, that tumor is out of their body, it's the best feeling in the world.